Welcome to The Art of Medicine, the program that explores the arts, business, and clinical aspects of the practice of medicine. I'm your host, Dr. Andrew Wilner. Today, I'd like to welcome Dr. Claire Unis. I listened to Dr. Unis give a lecture last month on narrative medicine, and I knew she would be a great guest on The Art of Medicine. Dr. Unis is the author of a new book, Balance, Pedal, Breathe, A Journey Through Medical School. I just finished reading the book, in fact, yesterday, and it's beautifully written. I've also got a few questions and comments. I'm so pleased that Dr. Unis is here today to discuss it. I'd like to mention that The Art of Medicine is available on YouTube as a video and on all major podcast players. If this is the first time you're watching or listening, thank you. And I guarantee you will not regret the next 30 minutes or so we spend together. If you've been here before, you know I select only the most interesting guests. And now, before we get started, I'd like to thank our sponsor, locumstory.com. Maybe you're curious about locums and how it might fit into your career story. But do you know all the different reasons physicians choose locums and how it works for them? At locumstory.com, you can hear firsthand stories as diverse as physicians themselves. There's not one solution for everyone. The variety of opportunities might surprise you. Locum Story is an unbiased educational resource. It has tools that let you explore trends in your specialty and compare different locums agencies. There's even a simple quiz to see if locums is right for you. Do your own research at locumstory.com. It's easy. All right, and now to my guest, Dr. Claire Unis. Welcome, Claire.
Thank you so much for having me. It's delightful to be here.
Oh, yeah. Well, I love having physician authors on my program. I'm a physician author myself. I'm interested in work-life balance, which has been a challenge for me, and I know for you after reading the book. And so before we talk about your book, tell us a little bit about yourself, what you're doing now, and then we'll work backwards to get to your medical school days, which is the topic of your book.
Okay, sounds good. Well, I have always been someone who is torn between my love of writing and literature and my love of medicine. So I started out as a creative writing and literature major in college, and then went to medical school. And then midway through medical school, decided I wanted to get a degree in writing. So I finished those degrees about 6 months apart. And then I went on to residency and really didn't do much in the way of writing for several years, as I established a practice and started to raise kids and so forth. And then I looked up and said, this is crazy. I really need to bring my writing degree back around and see what I can do, not only for myself, but to see what I could do in terms of helping other clinicians not burn out. So I came back around to where I am now. I'm a literature and medicine champion for my medical organization, which means that I've been leading some writing and literature classes and some narrative medicine classes for my fellow clinicians for about the last 3 years.
Okay, now for those of us who haven't learned about what is an old thing, right? Narrative medicine, it's certainly not a new thing. Doctors have been telling stories for a long, long time. And there's, William Carlos Williams, there's a long history, Anton Chekhov, there's a long history of physicians writing. But this has been formalized now into something called narrative medicine. Tell us about that.
That's a great question. So narrative medicine was actually born, I think, the same year I graduated from medical school, right around 2001. Rita Sharon and several others at Columbia University codified this as a field of medical humanities right around that time that was specifically dedicated to studying, absorbing, and learning from patient stories in greater depth than we tended to in medicine at that time. It was really intended as a way to point out that we had gotten too far away from really sitting with our patients' stories and learning from them and being able to advocate for them. So narrative medicine isn't just writing in medicine, which was something I agree has been as old as time. I think I'm certainly not unique in being a doctor who loves to write and loves the study of words and the use of literature. Narrative medicine is a little bit more of a formalized field of medical humanities now.
All right. Well, I'm just going to follow up. What
Mhm.
good is it?
So, I mean, that's fair, right? What good is it? Well, what we do in narrative medicine is we use something called a third object or a text. Now, a text can be a work of art in writing, it can be a performance art, it can be auditory, it can be visual. So we take whatever work of art it might be that is trying to tell a story, and we sit together with it and try to absorb what story is this text trying to tell us. And the good of it is that all art contains some ambiguity. And so when you sit with other people and try to interpret and fully absorb what that art is trying to tell you, it allows you to examine some kind of complex themes in a little bit more depth than you might if we sat down and said, okay, let's talk about our feelings, right? We're all a little bit like, yeah, no, we're not going to open Pandora's box. But if we take a story, if we take a text and say, what does this mean to you? What do you see here? Then it gives us the opportunity to not only interpret for ourselves, but to hear how other people may interpret that completely differently.
Hmm.
And that mental flexibility is extremely important in our ability to really hear what patients tell us and to be able to adjust our diagnoses and plans as a result of truly absorbing what patients may be trying to tell us. So think of it as like a mental exercise that improves your well-being. And a great side effect is that it also improves our ability to practice medicine truly with the kind of humanity that, in my opinion, medicine is intended to be practiced.
Well, I know for me, when I started doing creative nonfiction, it was
Mhm.
more a way to sort of deal with what was just stunning to me about a particular scenario. For example, when I was a neurology resident, I remember I had a patient who was locked in, and I had never
Mhm.
seen that before. I mean, I understood the neuroanatomy, where her brain was working, but she couldn't move. And then one day she wiggled her toe.
Mhm.
And, I mean, wiggling your toe is usually not a big deal, but in this particular scenario, and so
Yeah,
I wrote a poem about that because it was just so powerful. I published
absolutely.
a story about Alzheimer's disease where I had this elderly couple, and they came, and the man had memory loss, and the wife
Mhm.
did most of the talking, and every now and then the man would turn to his wife and he would say, "Oh, I love you," it was sweet and endearing and touching. And so finally, I said to the wife, "I said, well, I need to speak to your husband, directly, and so I can get sort of assess him a little bit." She goes, "Okay," and I said, "So, sir, tell me your name." And he says to me, "I love you." And it
Mm.
was just like getting, hit in the face, because she had not prepared me for that,
Mhm.
relationship with him, and what she conveyed, that his dementia was obviously very, very advanced. And
Mhm.
I did not realize that. And so it was just so I wrote a story about that because it was so stunning to me. So I think for me, that's kind of narrative. It was really just to help cope with
Mm.
extraordinary life events. Is that part of narrative medicine?
Yes, and I'm really glad you brought that up. So a typical narrative medicine session or class, if you will, involves sort of regarding, absorbing a text, discussing it, and then writing to a prompt. We call it writing in the shadow of a text. And what's amazing is that what people write is hugely different, vastly different things come out of this writing prompt. And part of it is whatever we're bottling up, we physicians are really good at bottling things up. We hold a lot of secrets. We're used to doing that. We're expected to do that. There's a certain level of austerity that we are taught to emulate. And when we're really given a chance to express ourselves, it is, in my opinion, extremely therapeutic to be able to let some of these stories out and let go of some of the things that we're holding on to that affect us, right? I mean, how many years later is it? And you can probably still picture that locked in patient and that toe wiggling for the first time, right? We hold on to these very emotional moments for years, decades, whatever it might be. And the smallest thing can transport us right back. Giving participants in a narrative medicine session an opportunity not only to absorb and discuss and reflect, but then to free write for like 5 minutes. It's not a long time. I think that's a huge aspect of narrative medicine that makes it so very useful to people who choose to participate.
In anticipation of this interview, I asked one of the medical students if they had narrative medicine class.
Mm-hmm.
And he said he didn't think so. He wasn't sure. So,
Mm.
so how widespread is this in medical schools across the country?
That's a great question. I feel like I looked this up, and there's 50 something programs that actually do have some
Ah,
element of
quite a few.
narrative
Quite a
medicine. So
few.
there's quite a number that do. Now, when you look at some of those programs, are they practicing narrative medicine in the way that I'm describing it? Maybe not exactly. So I've looked up some of the narrative medicine curricula, and some of them involve reading short stories ahead of time. So people can come ready to discuss the story. They've had a little bit more time to absorb it in advance. And many of them are using just written, so just short stories, or maybe poetry and short stories in terms of their texts for interpretation. So they're using narrative in more of the written form. But as I was researching for the Grand Rounds and for the presentation that you saw on Doctors on Social Media, I also found that there were examples like at Yale University where they were taking medical students to a museum and looking at 18th and 19th century artwork and asking students to describe what they saw there. And the idea behind that is that as students were asked to describe something unfamiliar, they actually were able to hone their perception and hone their description in a way that was not truly medical, but allowed them then to translate that into their description of, for example, lesions in dermatology. It was a dermatologist who pioneered that. So it can be used in many different ways, but it can also be morphed into programs that are various forms of something similar. I think that some of these medical school programs do not involve necessarily the prompted writing aspect of it. I know when I was in medical school, we had a medical humanities course that was, reading the classics. We were reading Oliver Sacks. We were reading William Carlos Williams, the classic stories by physicians, almost all white men at the time. But they were wonderful centerpieces for discussion about various aspects of medicine for us as medical students before we really had clinical experience.
I think in your footnotes you mentioned Richard Selzer.
Yes.
He wrote Confessions of a Knife and many other things. I got to meet Dr. Selzer when I was an undergraduate at Yale. He was brought in to one of our writing classes to speak. So I got to meet him and stay in touch with him a little bit. But he became widely popular. Sort of, I think he was before, he preceded Oliver Sacks in terms of as a writer. And it was unusual for a surgeon at that time in particular, I think, to sort of come out as a writer. But he was a very, very strong intellect. I think we'll put it that way. I mean, a very thoughtful, introspective guy. And if you knew him, it wasn't surprising. He wrote his autobiography, Down from Troy, which I read, which was pretty amazing, which allows me to seg into your memoir. So I think, about medical school, and it's very personal. I think you didn't pull any punches about what you felt and what you didn't feel and wanted to feel at that time. And so how does one decide even to write a memoir, and kind of, because it is usually, I don't know, my vision of memoir is it's some, 99-year-old person that wants to get their life down on paper before they're gone. But so they, for posterity. But this is relatively early in your career, I would say. But I think memoir writing maybe is changing also, that people are writing memoirs kind of earlier in their
Mm.
careers. So tell me about that. How does one decide to write a memoir?
For me, it had more to do with wanting to write about the process of change that we go through when we go through medical school. It was realizing as I was going through medical school that it was changing me, and that if I waited to write about it, I would not be able to remember everything that I was going through. And all of these aha moments that happen along the way. Um, and I knew as I went through it that the time to write about it was then. I knew that there would be no way to come back to those same feelings, those same discoveries, um, and also the same pain, because there is, anytime you're changing, even if you're growing, you're letting go of some aspect of yourself. In this case, it was aspects of innocence, I think, really. And some of those aspects I really would have very much liked to hold on to. Um, and yet I did not want to let go of the process of becoming a doctor. So um, it was that. And it was also, I thought of it, I think, more as a creative nonfiction endeavor than I did as like, oh, I'm writing my memoirs. This is not my whole life. This is really the story of one young woman who found her sense of self outdoors and in motion, going through medical school and deciding to allow herself to be confined and to be restricted in what else she was allowed to do in order to become a doctor. Um, and reflecting on whether it would be worth it, and reflecting on other elements of that. Um, so I can't say I set out necessarily to write my memoirs, but I start out by writing short stories about the process. And I actually had interest from an agent very early. And when I sent it to her, she said, I want this to be the whole story. I want it to have the whole narrative arc of going through medical school. And I was very intimidated by that at the time. So by the time I finished my 2 programs, the book was still missing a couple of chapters. There were a few I had to write later um, to really make it feel complete. And there was quite a bit of editing that I ended up doing when I came back to it many years later and decided, you know what, this book really needs to actually be born. I've been holding on to it for all these years. And when the pandemic hit is when I realized, I'm like, okay, this is my shot. I'm gonna do this.
So, because I remember being very impressed by the detail of, you were
Mm-hmm.
bicycling and the wind was blowing and the sky was changing and all of this stuff that is like, whoa.
Mm-hmm.
I mean, either she's just making it up to make it sound good, or she took notes. You kept a journal, I presume, in medical school. Is that correct?
Oh, yes. I kept a journal the whole way through. And also, bear in mind, I was simultaneously enrolled in the 2 programs. So I actually was writing quite a bit of it in real time.
So you had a kind of a real time kick, a
Mhm.
requirement, in fact, to
Yeah.
put it on paper. Well, that's always, deadlines are always helpful in terms of getting something done. Now, in terms of your medical school experience, I was actually it's maybe a generational thing, but you seem to enter the medical school uh, idea that somehow this would be enlightening and empowering and lifting. Whereas when I went to medical school, I knew that I was going to be miserable. I mean, I expected that I was going to be miserable, and that was the program. You were supposed to be. If you weren't miserable, then you weren't doing something correctly. So I think things have definitely now you were a little bit disappointed because you were a little bit miserable, in fact, and I don't think you were appropriately prepped for what was going to happen. But that you would even have the expectation that you weren't going to be completely miserable and exhausted for the whole duration was kind of astounding to me. I don't know if I'm alone in that, but it is a different generation. So do you think things have changed?
Oh, goodness. I don't know. Probably not. Probably I'm just an optimist, and believed that if this was something I was meant to do, that it was going to work out just fine. I remember thinking partway through, okay, what would I be doing if I weren't doing this? Right? Like, at least I was working towards something that mattered to me. If I weren't in medical school and using my time to study and all of that, I would be working somewhere else. And I really couldn't think of anything else I wanted to be working toward in terms of a profession. Um, yeah, I mean, I think I tend to be more of a glass half full kind of person. And for all that I was a little bit bowled over by what was required of me, I think it had more to do with the fact that I knew there would be challenges, but I didn't realize how much it would be a challenge to my sense of self and my sense of identity. So I think the part that you read about in the book that I'm really resisting is um, a little more of that kind of spiritual contemplation of, is it fair to just offer myself up and let myself be changed by by these experiences? Is that really what I want? Yeah, I don't know if that explains
All
it. I
right.
think it was just that
So
the challenges were different than what I expected.
you write that medicine chose you. What is how explain that?
It's my way of saying that I felt a calling to practice medicine. There was nothing else that I felt so sure I wanted to do. I wanted to feel like I had something to offer other people. I wanted to not just be of use, but have my work have meaning. Um, yeah, I'm not. I can't really. I mean, still, I've written a whole book about it, right? And I still can't put a finger on exactly how I came to decide I wanted to be a doctor, except that at some point it seemed like the obvious choice for me. And
And
it's an outgrowth of caring about every little creature and person that I came across, and also wanting to have some special skill I could offer other people.
yeah, well, you had some interesting role models, right? Your father was a physician, right? A radiologist
Yeah.
who helped people.
Hmm.
And I believe your mother was an artist. Is that correct?
Yes.
So they had sort of balance in terms of
Mhm.
who you could go to for advice and obviously some inspiration. Now, in terms of choice, let's talk about you. You spend quite a bit of time trying to figure out, as I did, what specialty to do.
Mm.
I'm board certified in internal medicine and in neurology, and I
Mm.
did a fellowship in epilepsy, which
Mm.
is not what I would necessarily recommend to people, but that there was a growth sort of as I went through internal medicine, then I discovered neurology and then went in that direction. But when I started, I just wanted to learn everything. And that I couldn't do, I realized, although I was pretty naive there. I thought I could learn everything. And then I figured I couldn't learn everything. So what was the most interesting? And it turned out to be the brain and kind of went that way. But I know you wrestled quite a bit with, okay, there's all these different specialties, and on each rotation, you get pretty deep into it with your OBGYN, delivering babies and, all these surgery and pulling drains and waking up at 4 a.m. and bicycling to work. So eventually, if I recall correctly, you settled on pediatrics. Is that right?
That is correct. Yeah.
Yeah. And, in my experience, pediatricians are always optimistic, nice people. I think, right? I mean, if you ever met a nasty pediatrician, it just seems impossible, right? So how did you find pediatrics?
So pediatrics was my first clinical rotation, and I really enjoyed it. I loved it. I did well on it. And then I just sort of discounted it because it was just because it was my first rotation. And so it took me a little while to come back around to it. Now, bear in mind, I at this point had already been a camp counselor for a couple of summers. I had taught skiing to children for a couple of winters. I'd spent a lot of time with and enjoying children. Um, And yet there was a part of me that rebelled against the idea of becoming a pediatrician because it seemed so predictable for a young woman to go into pediatrics, right? So I sort of rebelled throughout my whole life. I rebelled against being pigeonholed into any one identity, obviously, right? I couldn't just be a doctor. I couldn't just be a writer. I got to be able to straddle everything. And so I think there was a part of me that just sort of rebelled against being typecast as a pediatrician. And so I really felt like I had to try on these other specialties for size. And yet I came back around to it. And a lot of that had to do with the creativity that you have to use in pediatrics, with the ability you need to adjust to the age and developmental stage of each of your patients, which is hugely varying in pediatrics.
Sure.
And the delightful aspect of it is that there's an element of play also involved in my workday every day. So, it actually is a very natural fit for me. The fact that it took me a while to come around to it had more to do with my own internal rebellion than anything else.
Do you have one of those little teddy bears on your stethoscope?
I do not. I have a sparkly unicorn on my stethoscope.
Okay. All right. Well, this guy, adult internists usually don't do that. And well, I think so. Who should read the book?
I wrote this book. Well, I intended the book for a really wide audience. I think anyone who wants to know what it's like to become a doctor would benefit from reading the book. And I wrote it honestly with my friends who I'd known the year before I went to medical school in mind. So before I went to medical school, I took a year off from undergrad. I lived in Mammoth Lakes. I worked as a waitress and a ski instructor and did absolutely nothing academic or that would get me into medical school, which is why it was surprising when I got in. But when I would think, especially those first couple of years, when I'd think about how strange my experience was compared to the year that I had taken off, partly I think my audience that I had in mind were people who had no interest in going to medical school at all. Now, when you write a book about going to medical school, though, everyone says, oh, this would be perfect for the person that I know who's going to go to medical school or who wants to be a doctor. And I do think that is a natural audience for the book. I hope I succeeded in writing it in a way that it's accessible for people who don't have experience with medicine and aren't sure if they would even want to. Because a lot of what I did in the book, as you know, because you read it, is I interwove my experiences in medicine with experiences completely outside of medicine that had nothing to do with it. And that was a very intentional, but it was also the fun of writing it, is relating very disparate experiences to one another.
Yes, and I'll comment, I think it's beautifully written, and it's written, you can see that the author, being you, is paying attention to metaphor. And, when you're talking about, well, like the title, right? The title is about bicycling. And you got a lot out of bicycling, long distance bicycling, and bicycling with your friends, and the lessons learned. When you start at one point, you got to get from point A to point B. Just like medical school, you have to start at the beginning and you have to finish, and there are challenges along the way, flat tires and water bottle goes empty and traffic. And so, but I could see that it's like, oh, you're not just sort of writing the first thing that came to your mind. That was very clear in writing the book. And that's why I say it's so beautifully written. So I think it's a lot easier to digest than The House of God, for example, which you wouldn't necessarily recommend to potential residents. But I think, and this is, well, I think it's written from a woman's point of view. Also, it's very personal, and you're a young woman, and there are, I think they still talk about women's issues, and planning your career, thinking about a family. There's a lot of crossover between women and men, but women have their sort of particular concerns, and I think you focus on those. So I think particularly for a woman who's considering a medical career, this book would be well, I think it would be like one of your writing assignments in your narrative medicine class, right? It would be, let's read this and see what do you think about all that? Where does it take you? It's like, oh no, I'm not going to do that. Or, oh, I could do it this way, right? Or she did it that way. So I think it's an example, right? It's an N of one. And you made a lot of thoughtful decisions, and you're still struggling with work-life balance, right? There are children, husband, job, a lot of things going on. How's that going?
I don't think I'm struggling terribly much at this point. I think it's always been a goal for me to make sure that I am keeping these disparate aspects of myself involved in my life. To say that it's effortless would also be a lie. But I think this book is showing the very beginning of what has been sort of a lifelong pursuit of that intentional inclusion of various aspects of my life in one life. So I have a horse who I ride a couple times a week. I still go mountain biking and hiking and skiing and doing yoga, in addition to having a family and working, and now getting to do the literature and medicine classes that I just love to provide. So yeah, there are days that I wonder what on earth I'm doing trying to do all of these things, and yet I really wouldn't have it any other way.
Well, that sounds great. I'm going to give you a call. I think it asks for some tips for work-life balance. Well, we're running out of time. Is there anything else you'd like to add before we close?
No, I really enjoyed talking to you. Thank you for bringing up the book. I do have a website if anyone wanted to find
Sure,
out
I'll
more
put that
about
in the show notes.
Yeah, that's great. Yeah, sounds good. Thank you very much for having me on the show.
Well, I'd like to thank my guest, Dr. Claire Unis, for appearing on The Art of Medicine. Before we close, I'd like to give another thanks to our sponsor, locumstory.com, a resource where providers can get real, unbiased answers about locum tenens. I'm Dr. Andrew Wilner. See you next time.
This program is hosted, edited, and produced by Andrew Wilner, MD, FACP, FAAN. Guests receive no financial compensation for their appearance on The Art of Medicine. Andrew Wilner, MD, is Associate Professor of Neurology at the University of Tennessee Health Science Center, Memphis, Tennessee. Views, thoughts, and opinions expressed on this program belong solely to Dr. Wilner and his guests, and not necessarily to their employers, organizations, or other group or individual. While this program intends to be informative, it is meant for entertainment purposes only. The Art of Medicine does not offer professional financial, legal, or medical advice. Dr. Wilner and his guests assume no responsibility or liability for any damages, financial or otherwise, that arise in connection with consuming this program's content. Thanks for watching. For more episodes of The Art of Medicine, please subscribe. www.andrewwilner.com